We all know this COVID-19, it is more commonly seen in patients who have different comorbidities. That can be diabetes, that can be hypertension. Already, if a patient is suffering from heart disease in the form of old heart attack, or if patient had heart failure in the past, these are the patients who are more prone for the COVID-19 infection, and the complication rates are also more prominent in this subgroup. So definitely, uh, the patients who have this heart disease will always try to prevent the COVID-19 infection, so that they don't have to face all these complications. Now, basic uh, guidelines, those have been issued by different heart societies, American Heart Association, European Society, CDC, and the Indian government. They emphasize at prevention of the infection. So by prevention, what we need to do are the basic steps we have to take. One thing is social distancing. The patients who have heart disease, they should try hard to avoid contact with other general public, so that the risk of acquiring this infection goes down. Whenever we are stepping out of our houses, the masks should be used, preferably N95 mask, which has found to be most effective. But if not available, a triple layer surgical mask or even a cloth or linen mask would suffice, if at all we are using it properly. So if a patient has got heart disease, he should see to it to avoid stepping out of his house, and if at all he is stepping out, he should use mask compulsorily. Whenever out of the house premises, they should take care that they avoid coming in close contact with any other injured individual, and especially those who have symptoms of flu or the COVID-19 infection. Now, the patients who have heart disease should not miss their tablets. They have to take it very regularly, and each and every pill is important. Let's say if a patient is suffering from heart disease and he has got associated diabetes and hypertension, and if patient misses his diabetic medication or blood pressure medication, that would lead to derangement of the sugars and the blood pressure. That would further increase the risk of complication in this subset. Now, there was some discussion about certain medications increasing the risk of COVID-19, but all these studies, trials, those have been published, they have shown there is nothing like that. So the special group of agents like ACE inhibitors and ARBs, which were thought to increase the risk of COVID-19 infections, are no more thought to do that. And so patients should not think of stopping any of their medications or change any medications. They need to continue it very, very regularly. If at all a patient of heart disease, because of this stress or because of any other reason, feels to have any symptom like chest pain, breathlessness, loss of consciousness, swelling in the legs, they should immediately contact their doctor, the treating cardiologist, and get the things treated immediately.